published some work, and it was presented last year at ASCO and the year before at ASH about the molecular prognostication in smoldering multiple myeloma. So the context is that patients with smoldering multiple myeloma have very diverse prognosis. We see some who are truly smoldering and they won't progress for years and years, and some who will rapidly progress after the diagnosis. So far, the staging system that we have is what we call the Mayo Clinic, the 2008 version or the 2018 version, with mainly tumor burden measurements, which is the M-spike, the ratio of SFLC, and the bone marrow infiltration of myeloma plasma cells. And with this, we have three groups of patients: the one at low risk, intermediate risk, and high risk. So can we improve this stratification with the molecular knowledge that we have about multiple myeloma? So the team of Leif Bergzegel has recently published a paper in leukemia, and we have presented some work with Dr. Alan Gabriel at Dana-Farber Cancer Institute in Boston about this molecular prognostication in smoldering multiple myeloma. And what we see is that for the patients who have a unique alteration, which is a translocation or gain or a deletion 17p or mutations in the TP53 or ATR genes, as well as NRAS and KRAS, all these patients have a worse outcome and will progress to active multiple myeloma more rapidly than the patients who don't have these molecular alterations. What's interesting is some patients with these molecular alterations who are at high risk of progression would classify as low risk with the usual burden scoring system. So we see that we can basically rescue some of the prognostication of these patients. And it's an important question, of course, because there is a question beyond this stratification, which is the early intervention. And we are thinking that potentially in a well-defined population of smoldering myeloma patients who are at really high risk of progression, maybe treating them early on before the end organ damage would be beneficial for them. But for that, you need to select the population well, and you don't want to treat patients who would not have progressed for years and years. So that's molecular prognostication. will definitely help defining the right population, hopefully in the near future and in the coming clinical trials.